Okay, good morning, doctors. Today we're going to review this article about lupus and arthritis. And what we're looking for is what would be the link between these two pathologies. This is a review from September 2018. And well, the first thing we must know is the causes and treatments and conditions for lupus and arthritis are different, but there are also some significant genetic difference. What we're looking for here is that there might be a genetic link between these two pathologies. And because also we have to be aware that between these two conditions, there are a lot of very similar signs and symptoms. Okay, lupus often causes people to develop arthritis or joint pain. And arthritis or joint pain, doctors refer to arthralgia, is among the most common symptoms of lupus. Could be the first symptom that the lupus patient can show. But what is lupus? Okay, lupus is a chronic autoimmune condition that is characterized by an overactive immune system. It means our body is fighting against our own body. It's mistakenly attacking healthy parts of the body. And most of these parts of the body impact bones and joints, similar as arthritis. Lupus affects around 1.5 million American people, and about 9 out of 10 adults with lupus are women. The age of these women goes around 15 to 44. Okay. Well, but symptoms will be in many women mild. It means not really painful things, but for others, lupus can really be a big trouble because they can cause severe problems, mostly the pain on the joints and bones. We have several different types of lupus, but the one that is the most common is the systematic lupus erythematosus, which we call SLE, and it accounts for around 70% of the lupus cases. Okay, what skin areas lupus can affect? Well, mainly the mucous membranes on the mouth and nose, internal organs such as kidneys, obviously the bones and joints can also impact in the blood and can impact on the brain. What are the signs and symptoms? Well, we can have fatigue, loss of appetite, ulcers, and the most common sign on the face, the butterfly rash. Obviously, the muscles and joints, arthritis, and aches. Okay, and now, what is arthritis? Well, arthritis works as eroding the tissue in the joints that stop the ends of bone from scraping. Scraping means they are the contact against each other. This friction that the arthritis creates leads to further inflammation because it's scrapping, so it gets inflammation. And obviously, this will cause pain and swelling in the joints. Eventually, they will restrict their mobility because it will be so inflamed, so the pain is so badly that people can stop move. Even the fingers, even the toes, or the knees, elbows. Well, this arthritis will show a chronic and continuous inflammation in these joints, and it tends to worsen over time. And obviously, by the time it gets worse, it could cause permanent joint damage. As we can see in this x-ray, we can see how is the wear going. Okay, and it's changing. All the bones are totally twisted. Okay, arthritis is a chronic health condition and it affects around 44.4 million US adults. I mean, it's a lot of people suffering from this arthritis. And it's different from lupus because arthritis typically will begin to develop in people of more than 45 years of age. Lupus was before, like, well, we have two common types of arthritis, which are rheumatoid arthritis, we are going to call RA, and osteoarthritis. And then we will see what is the difference between them. Of course, we have to say and see that they are affecting mostly the joints. Okay, rheumatoid arthritis, it's an autoimmune disease that occurs when the immune system mistakenly attacks healthy tissues in the joints. Osteoarthritis is those protective tissues in the joints are slowly degraded by wear and tear. Okay, that's why this starts with people is getting older, over 45 years, because the wear, because of the movement, because of the or daily activities, will be wasting those tissues. The level of chronic inflammation is much lower than RA in the osteoarthritis. Okay, and what is lupus? Okay, lupus causes widespread inflammation throughout the body, including the joints. In some moment, it can develop arthritis or arthralgia with several other symptoms, such as skin rashes and fatigue. A small subset of people with lupus will have severe joint involvement and RI-like picture. They will be similar like RA, but not the same. This rare complication is referred as lupus. As you can see, it's combining arthritis with lupus. That's why we call it lupus. In fact, there's a band with this name, lupus. Okay, so what will be the major difference between RA and arthritis caused by lupus? Okay, when we talk about lupus, lupus is not that erosive, while RA it's really erosive. Second, lupus arthritis is much less severe than RA. And the difference will be that the joints affected are different. Arthritis in people with lupus tends to affect hands, knees, shoulders, elbow, and feet. Both lupus and arthritis are diagnosed based on symptoms, but also blood tests can be helpful, as also imaging studies. In some cases, we will recommend taking X-ray, ultrasound, CT, or MRI scan. And if our X-ray will show those joint erosions, then it's more likely to have RA because the inflammation in those X-ray. Okay, how can we make our diagnostics? We have to be asking our patient, taking care about the age and also the medical history. And then we can review and see all the x-ray we have, and we had to examine our patients. And then we had to look for signs of inflammation and reductions in the range of motion for affected joints. How are they moving? If it is painful to move fingers or knees, if we need those laboratory tests, then we can look for the ESR, which is the set rate, or the CPR, C-reactive protein, and we can measure the inflammation rate with these studies. Also, after we measure this inflammation rate, we can follow the disease activity or a support evidence or a flare. A flare means when the patient is feeling more symptoms, or the inflammation is getting worse. It's worsening. Okay, the treatments try to be effective for managing symptoms because we are looking for reduced further damage to the joints and organs, because somehow in the future these joints will be not able to move anymore, and that will make our patients feel more pain, and he will have to do no movements. So what we are trying to do is improve the quality of life of our patients. I mean, they need to learn how to live with their disease, but we can help them to prevent this immobility. These treatments usually will involve medication and lifestyle changes, and if the conditions have progressed, some people may need surgery to correct that damage or prevent further changes. What kind of drugs we can use for lupus and arthritis? Well, we use non-steroidal anti-inflammatory drugs like NSAIDs, and we also use disease-modifying anti-rheumatic drugs, DMR, SDS, and the example will be the hydroxychloroquine and some biologics medicine. By the way, do you remember we talked about hydrochloroquine? Like it's getting very famous now with the COVID-19 treatment. So that's why this kind of patients are suffering, because we are running out of this medicine. Okay. Also, we need those physical therapies so we can try to give some movement to those joints, and we have to be encouraging our patients to be active, because this activity will try to keep the joints healthy and preventing further damage. The kind of therapy that usually involves the treatment for arthritis will involve a series of stretches and exercises designed by a physiotherapist, trying to reduce first or mainly the pain, and later to prevent further damage. And we need to keep or even increase the mobility of the joints. Okay, as we saw at the beginning, we said that lupus will affect women mostly, and on the ages 15 to 44 or 45. So that leads us to be aware of that women can get pregnant in those years. So that's why lupus must be taken in account of those women of childbearing years, and because it's a real challenge for the rheumatologists or even gynecologists dealing with pregnant women and lupus. Okay, so I hope you understood what we try to review today. And okay, see you next week. Bye bye.